Good day everyone. So for today's video, I am going to perform the assessing of thorax and the chest. So first, let's go to the preparatory phase. Reassess the client's previous medical records if available. This is to obtain accurate history of the client's thorax and chest. Also to have significant implication in preventing medical errors. So here is our previous medical records. So next is to determine the scope of assessment needed. So prepare necessary equipment. So it is to gather relevant information why the patient seeks medical health care. So next is to perform hand washing and don gloves if if deemed necessary. So this is to prevent the spread of microorganisms, and by donning of gloves, it is where to avoid contact to blood and bodily fluids. So next procedure is to assemble equipments and supplies needed for organized work, place, and easy access of the equipments you will be needed. So here I already have my equipments. So next is to introduce self and verify the client's identity. This is to ease any client anxiety, make the client comfortable, and allows you to make a good impression and to ensure that the right patient receives the right assessment. So good day sir, my name is John Ryan Bako, and may I know your name sir?
My name is Mark Zuckerberg de Los Santos.
Okay, so your age sir?
I'm 20 years old. I was born in here in Don Carlos.
Okay sir.
Yes, my birthday is June 19, 2001.
Okay sir, thank you sir. So next is to explain the procedure to the client. So explaining the procedure to the client ensures cooperation of the client. So today sir, I am going to assess your thorax and your chest sir. So this is to assess if there are unusual findings on your body sir. So I just want your full cooperation sir, so everything will run smoothly.
Sure.
Okay sir, thank you sir. So next is to position the patient comfortably and provide privacy. So to provide comfort and help, this helps and build trust. So also the nurse can provide privacy by drawing curtains around the bed or closing the door to the room. So let's just imagine that we have a curtain around here. So now let's proceed to the assessment phase. First is the thorax. So inspect the respiratory rate, rhythm, depth, and symmetry of chest, chest movements anteriorly and posteriorly and laterally. So ask the patient to breathe normally, observe the respiration and the use of accessory muscles. So respiration should be regular and symmetrical, and the accessory muscles should not be used. So sir, I want you to breathe, just breathe normally sir. So I will inspect you. Okay. Okay sir. So next is to inspect the antero-posterior to lateral ratio, costal angle, spinal deformities, and condition of the skin. So this is to assess the shape and symmetry, also the condition of the skin and the movement with breathing. So sir, I want you to, can you take your shirt off sir? Okay sir. Yes sir. So, sir, I want you to take normal breath, sir. Okay, sir. Then, next is slightly palpate the antero-posterior chest for the tenderness and crepitus. So, palpation is useful in assessing for tracheal position, tenderness, and crepitus. So, also the chest exertion and the tactile fremitus. So, sir, I am going to palpate you on the chest and the back, sir. So, just stay still lang, sir, and take a simple breath, sir. sir. So now let's proceed to the assessment for chest exertion. So anteriorly, place the hands vertically on the chest with fingers spread on the costal margin and thumbs together at the costal angle like a butterfly. So this is to assess the respiratory expansion. So sir, I want you to lay back, sir. Hey, there, sir. I'm just going to perform this, sir. So it is included in our instruction. Okay. Next is the one. Posteriorly, place hands vertically on the chest with fingers spread and the thumbs together at the spine at the 8 to 10th rib like a butterfly. Ask the patient to take deep, slow breath as he does, then watch your thumbs move with respiration. So, sir, I would like you to face over there, sir, and turn to the side, sir. Okay, sir. Okay. Okay, sir. Next is to feel for equal expansion of the chest. If absent, decreased, or unequal, move up the chest. So now let's proceed to the assess for tactile fremitus. So place the balls of your hands with your fingers hyperextended or the ulnar surface of your hand on the patient's chest. This is to feel for vibration. Then next is to have the patient say 99 as you palpate vibration. So this is to assess for tactile fremitus or voice sounds palpation on the chest wall surface. So sir, I want you to lay back, sir. Then take normal breath, sir.
99.
And say 99 again, sir.
99. 99.
Last, sir.
99.
Okay. So also note level where perimeters is palpable, increase and diminish or absent. Increased perimeters occurs with condition causing fluid or exudates in the lungs. So decrease or absent perimeters occurs where there is air trapping solid tissue or decreased air movement. So now let's proceed to the percuss for the antero, posterior, and the lateral thorax. So first is to perform the immediate percussion in a systematic pattern. So percussion is used to assess the density of the underlying lung tissue. It allows you to determine if the tissue is predominantly solid or filled mainly with air or fluid. So there are steps. So first is to ask the client to bend the head and then fold the arms forward across the chest. Then next is to percuss in the intercostal spaces at about 2 inches intervals in a systematic sequence. Next is to compare one sided of the thorax with the other and note for areas or resonance, hypersonance, or dullness. Then lastly, percuss the lateral thorax every few inches, starting at the axilla and working down to the 8th rib. So, um, sir, can you turn over there, sir? Then kindly bend your head, then move your arms forward across your chest, sir. Like that, sir. Okay, sir, can you? Okay, I'm just going to percuss you, sir. Normal breath, sir. Okay, sir. Next is to assess for diaphragmatic exertion. So first, have the patient take a deep breath and fully exhale, then percuss the level of the diaphragm and mark. So this is to note areas of resonance, hypersonance, or the dullness to measure the distance between the two marks. Then have the patient take a deep breath and hold it. Then percuss the level of the diaphragm. Then measure the distance between the two marks. So, sir, can you face again over there, sir? Okay, sir. Can you take a deep breath, sir, and hold it, sir? Okay, sir. Exhale. Then another deep breath, sir. Okay. Okay, sir. And exhale na, sir. I'm just going to measure it. Yeah. Okay, sir. Next is to test for normal breath sounds and abnormal voice sounds. So first is to auscultate the chest over the auscultatory sides like the anterior, posterior, and the lateral using the flat disc of the diaphragm of the stethoscope in a systematic manner. So auscultation assess the airflow through the upper airways and the lungs. So next is to listen to one full respiratory cycle at each side. Um, this is to help differentiate breath sounds, note the relationship of inspiration to expiration, and which phase is longer. Then ask the client to take slow, deep breaths through the mouth. Listen at each point to the breath sounds during a complete inspiration and expiration. So listen for abnormal sounds such as the crackles and the wheezes, and for coughing and abnormal respiratory effort. So, sir, can you turn over there, sir? I just want you to take small breath, sir, using your mouth, sir. Small deep breath, sir. Okay, sir. Thank you, sir. So next is to note normal, abnormal, and adventurous sounds like then identify the pitch and the intensity of the sound. So next is to have the patient cough, then listen to if sounds has cleared, if um, adventitious sound heard. So locate the area where the sound is heard best. So sir, can you face over there again, sir? Um, can you um, can you cough, sir? Thank you, sir. Next is to have the patient say E, then it will sound like a over affected area. So, sir, again, sir, over there, sir. Can then I'll just say, can you say letter E, sir? E. Again, sir. E. Sir, again. E. Last, sir. E. Okay, sir. Next is have the patient say One, two, three, clearer transmission of spoken voice sound over the affected area. So, sir, again, sir, can you say one, two, three, sir, slowly?
One, two, three.
Then,
One, two, three.
again, sir.
One, two, three.
Last, sir.
One, two, three.
Okay, sir. Next is have the patient whisper one, two, three, clearer transmission of whispered voice sound over the affected area. So, sir, again, sir, can you face over there, sir, and say and whisper one, two, three, sir.
One, two, three.
Again,
One, two, three.
again, sir.
One, two, three.
Last, sir.
One, two, three.
Okay, sir. So now let's proceed to the heart and the central vessel. So first is to measure for jugular venous pressure. Position the patient with the head of the bed at 30 to 45-degree angle. So this is to identify and palpate each cardiac site for pulsation, thrust, heaves, and trills. Next is to place a ruler vertically, perpendicularly to the chest at the angle of the Lewis or the sternal angle. Then identify the highest level of the jugular vein pulsation if unable to see the pulsation. So use the highest level of jugular vein distension. This palpation is useful in detecting abnormal pulsation or movements such as trills, lifts, and thrust. So, sir, I want you to lay down over here, sir. Normal position, sir. Okay, sir, then I'm just going to put this. Then, place another ruler horizontally at the point of the highest level of the venous pulsation. Then measure the distance of the jugular vein up from the chest wall. Okay. 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 Then, lightly palpate each carotid separately with caution and note for rate, rhythm, amplitude, contour, symmetry, elasticity, and thrills. So, palpation is also useful in detecting abnormal pulsations or movements such as thrill, lift, and thrust. So, sir, I am going to palpate here, sir. Okay. Yes, sir. Next is have the patient hold breath and auscultate the carotid with the bell portion of the stethoscope for Broids. Auscultation is very useful in assessing heart sounds and vascular sounds. It is used extensively in the cardiovascular assessment to evaluate cardiac function. So, sir, I'm going to auscultate you, sir. So have deep breath, sir. Again, sir. Okay, sir. Wait. Last, sir. Okay, sir. Next is to auscultate the jugulars with the bell portion of the stethoscope for venous hum. So bell is best for detecting low pitch sound. So, sir, I am going to palpate you on your jugular, sir. So, just take normal breath, sir. Okay. Last, sir. Okay, sir. Um, Next is assess for the precordium. So first inspect for pulsation of the precordium and paying particularly attention to the apex area. So position the patient in supine position with the head of the bed elevated between 30 to 45 degrees. Then stand on the patient's right side and look for the apical impulse. So, sir, I'm just going to inspect you, sir. Okay, sir. So, next is to palpate the apical pulse, remain on the client's right side and ask the client to remain supine. So use one or two finger pads to palpate the apical impulse in the mitral area. So fourth of the fifth intercostal space at the mid-clavicular line. This is to detect pulsation. So sir, I am going to palpate you, sir. Okay, sir. Next is to percuss the area to determine the cardiac borders. So, sir, I am going to percuss this area, sir. Okay, sir. Then, next is to auscultate heart rate and rhythm. So, place the diaphragm of the stethoscope at the apex and listen closely to the rate and rhythm of the apical impulse. So, the diaphragm of the stethoscope is best for detecting high-pitched sounds. Okay. Sir, I am going to auscultate you. Okay, sir. Next is to auscultate at each side, the apex, the LLSB, the herbs point, the base of the left, and the base of the right. Note S1, S2, S2, and the extra sounds or the murmurs. So, again, sir, I am going to auscultate you, sir. Okay, sir. So, auscultate with the patient assuming other position. So, this is to identify normal and abnormal sounds and to note rate, rhythm, extra sound, or murmurs. So, ask the client to assume a left lateral position, use the bell of the stethoscope, and listen at the apex of the heart. So, bell is best for detecting low pitch sounds. So, sir, I am going to assist you on a lateral position, sir. Sir. Then, I'm just going to auscultate you, sir. Okay, sir. Next is to ask the client to sit up, lean forward, and exhale. So use the diaphragm of the stethoscope and listen over the apex and along the left sternal border. So the diaphragm of the stethoscope is best for detecting high-pitched sounds. So sir, I am going to assist you on a sitting position, sir. Okay, sir. So, can you lean forward, sir? Bend your body, sir. Not, sir. And take breath, normal breath, deep breath. Okay, last, sir. Okay, sir. Okay, sit normally, sir. So, sir, I am going to assist you on putting your shirt, sir. So, sir. Thank you. Then let's go to the termination phase. So review the information obtained during the assessment phase and discuss the findings to the client. Then present to the client possible plans to resolve health concern if present. So sir, as I have gathered your assessment, sir, and your finding is that you have a crackle on your lung, sir. So I am going to refer you to a doctor, sir, for your medication and for medical assistance, sir. Is that okay, sir?
Yes, it's okay.
Okay, sir. So next is to measure the client's understanding of the plan and the need for further teaching. Provide client the opportunity to clarify, ask uh, for any concern. So, sir, do you have any question or any concern, sir?
No.
Okay, sir. Thank you, sir. So, I am going to end the interview politely. So, sir, thank you for your cooperation, sir, and have a great day, sir.
Thank you.
Okay, sir. So,
No.
do aftercare, then fix the equipment used and arrange it properly. Okay. Um, Perform hand washing. Then last, document the findings in the client's record.